welcome. We are back for another table talk. Hello, and thank you all for joining us. Looks like we have thousands of followers clicking on. So how exciting. We have a new setting. We're outside the clinic here, and we have some friends from CHIP. We have some guests that are joining us. This is a new setting, so bear with us. Kind of interesting. I get really nervous on camera when I could see myself, so I'm looking at a screen, so I'm kind of nervous. So welcome. This is Suicide Prevention Month, so we're talking about suicide prevention this month. That's why we brought our friends here from CHIP. We're going to introduce them. I just want to give everybody a heads up of what's going on out here. We have some guests that are joining us. We have some friends in the audience that are going to help us with our conversation. We're going to talk about some hot topics for the month. We're going to share some resources and some activities. And you're going to join us for however long you can. And then we were going to do the best we can to provide all the information possible. So with that being said, I want to start by just sharing really quick that Monday's our suicide prevention walk. If you haven't registered yet, sign up. Join us for the walk. That is going on Monday at noon. Anybody that is registered is going to get a hat. We're going to walk up Gulch Road. Please wear yellow to identify or help. Yellow is Suicide Prevention Month color. Right? Did I say that right? Yellow is suicide prevention. Yellow is the color we wear for suicide prevention. So if you can wear yellow, if you've driven up and down Gulch Road, you'll see the yellow ribbons. That's to signify, suicide prevention and remember those that we have lost. Suicide's a serious topic. It's definitely impacted our whole community. When we have these conversations today, we want to do so, with the utmost respect and empathy. And the goal here is just to provide, more information and help people understand a little bit more that so that we can maybe help people that are struggling with this kind of stuff, because it can be really, really difficult to experience things like this. Even if we as a family member are dealing with somebody who's thinking about things like this or has mental illness or mental health issues. So with that being said, I think we should get to our friends that we have here from CHIP. CHIP is the Community Health Improvement Partners. When we talk about suicide and mental illness, Art, Marissa, and myself, who aren't joining me today because they're helping with mental health first aid training, they are. We really rely a lot on our friends and our resources out in the community. Excuse me. Sorry, I don't have COVID. I'm good. Just nervous, but. We rely a lot on our friends in the community, and by friends in our setting, friends are people that have information and have the facts. And so when we come out and when we talk about things, we want to make sure that we have our facts straight. We want to make sure we have our resources together, because when we share things with you, when we share things with the community, we're solid. Our word has to be good. Our connection has to be strong. It's really important to us. And when we have the people that we love and people we care about, because we live out here, we're from out here, our family's here, we want to make sure that we're connecting and we're sharing information that is golden. And we connect with people that we know, people that we trust. And we've worked with CHIP for some years now. And these are people that are always there for us. They don't hesitate to share, to support us, whatever we need. And We thought with our table talk setting, to invite them out so you guys can meet them. These are the people that help with the pamphlets, the sign-in sheets, and things like that. So if you see some of the materials, or if you see us with new materials or information, chances are that our friends here have been behind some of it. So let's introduce our friends. So who Susanna? Brett?
I'll go first. Good afternoon, everyone. I just wanted to say that we're very thankful for being here with y'all today, and we're very appreciative of how welcoming you all have been, and we can feel the support. We love your guys' energy, and again, we're super excited to be here talking about suicide prevention. I'm Susanna Bustamante, by the way, and I am the Suicide Prevention Council Program Coordinator. I've been with the council for about 5 months now, so it's been such a beautiful experience seeing the level of connectivity, of collaboration, and just being able to interact on a daily basis with individuals that have so much care, love, and passion towards community wellness. And that's something that I love about our job, and I appreciate the team and our partners. Especially having spaces like these, like where we can talk about these conversations and advocate for suicide prevention and mental health in general. I'll pass it on to Brett.
Yeah, thanks, Susanna, and thanks, George, for having us. George is a longtime partner of ours, and we're just so glad to be here at Indian Health Council today. My name is Brett Hall, and I am the program manager for Community Health Improvement Partners, and specifically, we facilitate the San Diego County Suicide Prevention Council. Community Health Improvement Partners, also known as CHIP, we have a mission to advance long-term solutions to priority health needs. So we have a variety of programs, including a resident leadership academy, a housing program, recovery program, and also a program that focuses on food systems. But we particularly focus on suicide prevention and mental health. So our council does not provide direct services, but we're more of an overarching entity that brings together folks that are all working on suicide prevention in silos so that we can have a coordinated effort. So we're a community-wide collaborative focused on a vision of zero suicides in San Diego County. And we have 8 active subcommittees, and then we also provide trainings and education. And we're just really excited to talk with you all today.
Well, great to see you guys. Great to see you guys out here. We do a ton of stuff, but our main focus is suicide prevention, and we have a huge variety of activities that we do all year. September is when we really hone in and focus on suicide prevention. So we thought it would be ideal to bring you guys out. So thank you for taking the trek. What did you guys think about the drive?
It was nice. Yeah, I'll do it again.
Yeah. Okay, well, we'll take them up on that. They said they'll do it again. So the report card just came out, right?
Yes.
I finished it up. The report card's a really big deal in the suicide prevention field. I think the report was positive for the most part. Do you guys want to go over that a little bit?
Yeah, for sure. So what George is referring to is our SPC, our Suicide Prevention Council annual report to the community. So every September during Suicide Prevention Week, we release this report, and it's an update on the status of suicide in San Diego County. And then it also is themed by one of our strategic directions for the SPC. So this year it focused on clinical assessment and treatment. We take the opportunity to release it through a press conference. So we were able to hold a press conference on September 8th downtown at the County Administration Center. We were able to have quite a few folks there speaking about suicide, spreading awareness, resources, education. We had Chair Supervisor Nathan Fletcher there, as well as Dr. Luke Bergman, the Director of Behavioral Health Services for San Diego County. And then we had a few just expert testimonies as well from some of our partners. And those are related back to the report. So I have a copy of the report here. You can find it on our website. It's linked right on the front page. But the report kind of starts off with an overview of the status of suicide over the past year. The main reason a lot of people pick it up is for the second page, which is the actual report card. So that's the update on data. And we actually got some hopeful news this year. The suicide rate is down 11% from 2020 to 2021. So it's really great news. In 2020, there were 419 deaths by suicide, and in 2021, there were 364. So we're really glad to see that it's continuing to decrease and that our efforts are making a difference. I think it's also just important to highlight that we should stay vigilant and steadfast in our efforts, especially after the pandemic, just with all these added stressors in our life and people dealing with grief and trauma and loss still. But yeah, so that's the second page is the report card. And then when you flip through it, there's a bunch of different narratives, all through the lens of clinical assessment and treatment. And then when you get towards the back, we have one page that's dedicated to resources, and then another page that is kind of how to get involved. So there's 10 action steps that you could take to get involved with suicide prevention efforts. And then our last page is just kind of an overview of our work for the SPC. So yeah, that's just an overview of the report.
So I read the whole report. And so I think it was all important, all good information. One thing that stuck out with me is I really appreciate you guys sharing the positiveness of the 11% going down, but the impact still that just one suicide has on a family, on a community. And so it can devastate a whole community. And so, yeah, we're encouraged by the numbers going down. We're encouraged by our efforts, but it's never over. And CHIP, the SPC, the Suicide Prevention Council, took on the challenge of making it a zero suicide county. Mm-hmm. And that's a tall task, and that means that, there's always work to do, and I don't think we want to set ourselves up for failure. I think it just means that we're always trying, and we want to be positive, but we definitely want to be mindful that that to respect this work and to have empathy for the ones that we've lost. The cameraman's pointing to a comment. Do we have a comment? Okay, let's see. What's the web address?
Yeah, so it's www.spcsandiego.org.
Okay.
Yeah.
www.spc.org.
spcsandiego.org.
spcsandiego.org.
Yeah.
Okay. Susanna, did you have something you wanted to add?
For that comment?
Or it looks like we wanted to add something. I cut you off. I have a great ability to cut people off. I used to be a one-upper, but I am no longer a one-upper anymore, contrary to what one of our audience members wants to say. I'm no longer a one-upper.
Yeah, I'll comment on kind of just restating that September is for Suicide Prevention Month, and it's just really important that we all continue to have these difficult conversations, and the more we talk about it, the more we normalize it and reduce the stigma that still exists, right? And so a great way to be more involved is also taking the trainings. You can also view that on our website. We have a number of trainings where you can begin to learn the signs and be more involved and truly have an impact within your own community, within your own circles. And in general, like I mentioned, just talking about those topics that are difficult to talk about. And then also just, I wanted to mention that mental health is also not linear and it could be a messy journey. And it's also about embracing the highs and the lows and everything in between, and kind of also being okay with not being okay, communicating with others, checking in with our loved ones, even our community members, and those are just things that have been coming up a lot. And I feel like September is such a great opportunity and time of the year to kind of think about, reevaluate, reflect on all these things, and make sure that we're doing our part and talking about suicide prevention, talking about mental health, and reaching our community in the best ways that we can.
Yeah, I think that's a good point. You know, if September is what's going to do it, then let it be. You know, yeah. If you have a comment, question, please use the microphone. But we want to encourage you guys to chat, share. If you have some feelings, please share. Yeah, there you go. It's on.
Is it on?
Yep.
Can you hear it?
Yep.
Yeah.
I can't hear, but I'm sure everyone else could hear. Yeah.
Okay. Yeah. So I was just kind of curious. Why is it September, the month? When I was just thinking, I had a thought in my mind, just thinking right now. Is like, what about Suicide Prevention Year?
Yeah.
Because you know, you can bring it up every month. You know, because it's ongoing, like we're talking about, and to just focus it on 1 month, I think is not. I mean, if you're striding for zero suicide, you know, I think every month might be an idea to think about.
Yeah, definitely. I think that's a great point. I think suicide prevention is important every single day, not just Suicide Prevention Month. So that's a really great point. And I think a lot of this, these types of conversations do get brought up during like May is Mental Health Month or September is Suicide Prevention Month, but it's important to keep them going year round. And then just building off of what Susanna said, I think that's the easiest way also to just make a difference like in your own life is by simply having these conversations that are hard to have. Because usually when people are struggling with these thoughts, they're stuck and they feel like they can't talk to anybody about it. So just recognizing folks in your own life that are struggling and having the courage to create a safe space and have that conversation with them can just make all the difference. So, yeah.
I think we should make a slogan of what you said. Like, sometimes it's okay to not be okay. And if we were all confident and trusted each other to not be okay, I think it would be a little healthier. I think we could be a little healthier. I don't know if that's oxymoronic, but you know, if we could trust each other that we weren't okay today, but we're gonna be okay. Just let me be not okay and help me when I'm not okay.
Yeah.
You know, don't try to fix me. Just let me not be okay. You know, and get me the tools that I need or the resources that I need. You know, because I'm not okay right now. This is going on. You know, the seasons are coming up. You know, I thought that's what you were going to say was, you know, why is September Suicide Prevention Month when the holidays is really when things get hard, you know, because those of us that have, you know, that deal with seasonal affective disorder, the holidays come around, those are really, really difficult times, you know. You know, sometimes we're just not okay, but we have to just really force it and put that facade on, you know, for the kids or for work or whatever it may be. But.
Yeah, for sure. I think it's an unrealistic expectation in society today that to just put like a brave face on and act like everything is fine.
Right.
And I think that's just one of the small positives that's come out of the pandemic is that I think people are starting to really talk openly about where they're at. I think it has started to break down the stigma a little more. I think you can even just tell from the pressure like on our behavioral health systems right now, where we have a shortage of workers and we have an influx of people that are trying to access services. So I think people are just really being more honest about where they're at, how they're struggling, and reaching out for help, which is good.
Do you know why that has gone up? Even though it seems like with COVID in the pandemic that we got more services going on now with telehealth, with virtual visits. Why is it now harder than ever to get services?
Yeah, I think what I've kind of been seeing and hearing is burnout is like real. I think not only burnout, but also I know a lot of clinicians are feeling compassion fatigue. You know, they're just overworked. A lot of people are reaching out for help, and there's only so much that one person can do in a week based on their caseload. So I think people are feeling burnt out, a little bit of compassion fatigue. with more people reaching out for help, we also need more people that are available to help. So I think that's part of it.
Yeah, yeah. But I think that is when there's a lot of silver linings that I personally have seen come from the pandemic, like, spending time with the family. That was a blessing.
Yeah.
There was a lot of tough things that happened as well. But the virtual visits opening up, and people, all of a sudden you started hearing people say, we need more of that mental health, or more of that. They need more mental stuff at schools, or the kids need to be at school. That was like the conversation that you go to the game. It's like, they need those talks, George. You need to do those talks with them. It's like, well, every time I did those talks, you don't want to shut up.
I think for during the pandemic, there was definitely a pause in life in general. And I feel like it was such a great time to kind of stop and reflect on how you're feeling. I know for me personally, during the pandemic, I really questioned, what am I doing with my life? What are my values and what am I doing? I've always known that I love helping others and really care for the community. And I know that before the pandemic, I wasn't really doing that. And I felt unfulfilled, and it really brought me to where I'm at right now with the SPC, and I love it. And I feel like a lot of individuals also went through that, right? Really came to be more in touch with what are their core values, being with the family, kind of trying to figure those things out. And I feel like there was definitely a lot more clarity, and more people have been connected with wanting to be in a good mental state. And I feel like that's very important, and we should keep that groove going and expand on it and continue these conversations, and also find comfort and support with one another. I feel like we're also, as a society, have been very separate, but at this moment or this time kind of also forced us to reach out, stay connected, whether it was through Zoom, but also virtual settings have also allowed individuals to have more access, right? And with meetings, and then being able to tune in meetings from the comfort of their home, to have that privacy, but also be connected. So I feel like it's definitely an exciting time, and I love that I'm a part of this, and that we're having this conversation, that we're having this table talk now. This is important, and I'm glad that we can reach as many people as we can, and to continue these conversations. Yeah.
Hey, we're always trying something new. So it looks like we got another question.
Yeah.
Let's see. This is a very serious topic. This is a very serious topic for me. My son took his life on September 14, 2021. And I tried to reach out for help about his mental state. At that time, because he was of age, he had to be the one to reach out for help. I'm glad you have this type of program, and hope it will help those in need of real help. Thank you.
Yeah, thank you so much for sharing. We appreciate your vulnerability. I think if I can offer just one piece of support to that person, they might already know about this, but one of our partners is SOSL, Survivors of Suicide Loss, and they provide, they have a warm line that folks can call. They also provide support groups, and it's for those that have lost a loved one to suicide.
And so we share periodically. They have a Native American support group too. I think it meets like the second Thursday of the month.
Mm-hmm.
We can reshare that, but they definitely have a support group. But I appreciate you sharing that comment. This stuff, it's real. And like I said when we started this, the reason I brought our friends out is because we really take this seriously. This is what I do out here, and I love my community. I love the people that I work with. I can very well come across one of my kids or one of my nieces or my aunt or somebody when I'm out here, So this is very real, And so when I come to you guys, it's like, hey, I need this, or you guys got that, It's like usually it's like tomorrow or yesterday, But you guys are there for us with facts, And I don't want to give out stuff that's not realistic. I don't want to have things that maybes or I thinks. We need to give you guys facts and strong resources. So I appreciate you guys sharing that information. I think we got a comment.
Yeah, I just wanted to mention that we also have a Mending Broken Hearts Grief and Loss workshop here at Indian Health Council. And we are having one starting next week, but all the seats have been filled. We're going to try to have them at least, maybe every 3 months or so, every quarter. So that's also another resource.
Yeah, thanks for sharing that. I think postvention in general is sometimes an afterthought when we think about suicide prevention. That the aftermath after a suicide loss, and the amount of support that's really needed. Like those people that are affected by that need to be wrapped up in community and have spaces to be able to process it. It's just such an important part, especially to protect those people, to keep their mental health intact, and so that they don't later on become at risk of having suicidal thoughts. So yeah, just suicide is such a complex issue. It can affect, I think, on average, by one suicide loss, there's a ripple effect, and it could affect 120 people around them. So just having groups like that is huge.
I was curious to know, do you guys know of techniques or ways to get people in the door so they can seek the help? How to talk to them?
I'm kind of giggling because I think I do, but I'm not that good at it. We're always working on it. There's always new strategies. There's what works for one person, it doesn't work for this person. I might get this person in, but I might offend that person. And I think it's just constantly evolving and different strategies. I mean, I think we're gonna all probably have different answers. I think everybody in the group's gonna probably have a tip or a trick.
I think also, though, our QPR training. So, Susanna, I don't know if you want to share more about that.
Yeah, so we do offer, thank you, Brett. We do offer a question, persuade, and refer gatekeeper training. And it's basically for that, like kind of suicide prevention and kind of learning the basic skills needed for recognizing those warning signs. And also for anybody who you think or suspect might be contemplating suicide, and how to question, persuade, and refer them for help. And we also provide all those resources needed and kind of guide through that process. But it all comes to being empathetic, having that human-to-human interaction, asking questions, talking and communicating, and letting that other person know that you're there for them, that they're not alone, and that you'll help them throughout the process, being that supportive and listening ear.
Yeah, and the QPR training is free. It's an 1.5-hour training. It's just how to get your foot in the door and learn how to help someone that is struggling. The refer part is where you learn how to help that person get help, basically. And we offer them once a month on the 4th Friday from 10:30 to 12 via Zoom. And then, so you can just attend that as you'd like. You just register online. And then we also have the ability to go out into the community and provide them to groups for free. So we have like 20 to 30 trainers that can go out and provide trainings in person or virtually to a group. And that's really the best way to learn those tips and techniques that you're talking about.
And I think that's where my team, me, Art, Marissa, have the most success. Not necessarily getting them in the door, where I think some do, but with our groups and our trainings, like our mental health first aid, our QPR, we have ours on Monday for our walk. But the Mending Broken Hearts, now that the behavioral health is doing more of the postvention, as you called it, or our support groups, the more our behavioral health team is opening up those opportunities. Like we like to call, like in the mental health training, it's there's professional help and there's self-help, and then support group strategies. Not everybody wants to come in and do the therapy or that type of care, and that's okay. Maybe that's not for them, or maybe they're not ready for that. But the groups, and especially when the groups are done with the culturally appropriate things that we like, or things that are working, or things that have worked for people that actually are in recovery and things like that. Those are, I think, where I have more. I think those work better getting people in are where we're are most effective. But so I hope that answered your question. Yeah, yeah. Groups, drum groups, gatherings, things like that could be just as effective. You know, could help. Yeah. So any comments, questions? If you have a comment, use the microphone, please. We want to hear from you guys. If you're online, please comment, chat. We want to hear from you guys. We have our community health improvement partners here that are joining us from coming all the way from San Diego. So we appreciate you guys taking the journey. We have a comment.
Oh, I just wanted to reinforce that, we do have 3 QPR certified gatekeeper trainers here at IHC, and we can offer those both here and we do out in the community. But also wanted to kind of have a little bit of a discussion about what you think are some of the common misperceptions about suicide.
Yeah, for sure. And we actually, there's a full section on that in the QPR training as well, if you want even more information after we talk about it now. But let's see, some of the myths and misperceptions.
One of the biggest myths that we see out here is don't talk about it. Leave them alone. Okay? It's going to go away.
Yeah. Or like, if I talk about it, I'll make it worse.
Yes.
Yeah.
Okay, so don't talk about it.
Yeah. I think also there's the common myth that if you hear someone say like, oh, if I fail this test, I'm going to kill myself. Or, if you break up with me, I'm going to kill myself. And it can be said really flippantly in conversation. And so people sometimes think if someone is talking about it like that, then they're okay. They're fine. They don't need help. They're just, joking. But in reality, if they said it, it really might be on their mind. It really might be something that they're contemplating. So in a situation like that, you just want to be sincere, show empathy, be like, hey, I just heard you say that you wanted to kill yourself. Like, are you okay? I just want to check in. I just wanted to see where you're at. Did you really mean that when you said that? I think that can also be a common myth.
Yeah, so some of the other ones, like the more common ones I think that we see out here, is that if they make threats, they're not going to do it.
Yeah.
If they talk about it, if they make threats, they're not going to do it. And sometimes we find, unfortunately, if they make threats, and the more threats they make, the more help they may need.
Yeah.
Where we used to think at school like that's just what they do. They're just want attention,
Yeah.
and that's actually what they want. They need attention. They're asking for help.
Yeah.
Yeah, even like in Mexican culture, like there's this saying that a dog that barks won't bite. And it's like this idea of like, oh yeah, if they're all talk, they're not going to do it, right? So we really have to challenge these old sayings or these comments and really just, like if somebody says it, take it seriously, because it's always better to be safe than sorry. And just having these conversations, checking in, like, what did you mean by that? Like, what's going on? Tell me. But really having that sincere interest in wanting to help, because individuals can read right through if you're just asking for, but not really interested in what they're going to respond. And I think that, these are all things that there are a lot of misconceptions, and we need to give out that correct information and continue to have these conversations in order to reduce the stigma.
Yeah, I think one more that just popped to mind is there's this common misconception that only like clinicians can help prevent a suicide, or only an expert can do it. But I think really what we need to think about is who is the expert in suicide prevention? Like, is it the clinician, or is it the person with personal experience? Or is it the counselor? Is it a teacher, a coach, a friend, just a trusted family member? Really, anyone could be the expert, and anybody can help save a life. That's really like what we like to say with the Suicide Prevention Council, is that suicide prevention is everybody's business. So that's definitely one of the ones we hear too.
Yeah, and I think that's why we took on the QPR and the mental health first aid training, is because it empowered our whole community. You know, if you felt like you wanted to help, that's definitely trainings that could give you the tools to help, you know, and get them here. You know, another way to get people in these doors, but and definitely not put the burden on just one person. You know, you can work together with people, but who is the, you know, there's a ton of professionals, you know, but we see all sorts of different people, all sorts of different approaches out here in our community. Maybe a little different than you know, town or the city, but yeah.
Yeah, I think another one is that that suicide is not preventable. So, like, once someone makes up their mind, you can't change their mind, and that's definitely like a big myth, right? So, the fact is actually that people are usually really ambivalent about it. They're usually going back and forth. They don't have their mind made up. They're struggling, and they just can't find any other way to get rid of their pain, right? But that's why us as helpers, what we can do is show them that there are other ways that they can get rid of this pain, and that it is preventable, which is why all these trainings exist. And there's tons of folks who have had suicidal ideation that have gone on to live and have healthy lives.
That's probably the just to be transparent, that's probably the hardest thing when we cover that in the QPR. That's probably the hardest thing for me to share, is that suicide is preventable, or that somebody that has their mind made up, because chances are somebody in the room has dealt with it or experienced it, and it sounds like, you know, I don't want it to come off like, you know, your situation could have been prevented, but in fact that's what we're saying, you know, and I think with the way when we talk about it is by saying, you know, knowing the signs, you know, could prevent this in the future. And that's usually what happens is people then start informing themselves, becoming aware, and after a loss or things like that, start realizing, because let me back up a little bit, especially with major impact suicides that impact the community, like young people, you usually will hear like, you know, this was a great kid, we never knew this, nobody thought, you know, but shortly after a short period of time, you start seeing these signs. The more they become aware, because, you know, they start learning about suicide prevention, they start becoming part of these groups, then they start seeing the signs, because they weren't aware, they weren't close to suicide prevention world, because not everybody is, unless you're working with it or joining one of these talks, you know. So then they say, oh, now, you know, if I would have known. But one of the best things I like about the QPR is when it says, don't hold yourself, you know, don't feel guilty about something you learned today about something that happened yesterday.
Yeah.
So,
Yeah,
I kind of rambled on there a little bit, but it just, some of these things are hard to cover, even as trainers, you know, even though we're informed ourselves, you know, but, hey, we got to cover it, right?
Yeah. Yeah, for sure. It's not an easy thing to talk about. It's complex.
So can we talk about some of the warning signs and things people should be aware of and look for?
Yeah, for sure. Another big section of QPR, so definitely come to a QPR training if you want to learn more. But there's all different types of cues and warning signs. So there's behavioral, there's situational, there's verbal. Sometimes people will just outright say how they're feeling. But I think overall, the big thing to look for is just like any changes or things that are out of the ordinary. So changes in mood, in behaviors, and then when those are overlapped, when you're seeing like several things like that. So it can look like a variety of different things. Maybe someone has gone from feeling very happy to very sad. They're usually really upbeat, and then you're seeing that they're down all the time. Or if you're seeing that they're, usually kind of a lower mood type of person, and then they're feeling really happy all of a sudden. It can be that they finally have a plan in place and they're feeling relief. So that could even be a sign. Sometimes it could be giving away prized possessions. It could be acquiring a firearm or stockpiling pills. That would definitely be a warning sign. A loss of any major relationship, that can be a sign. Getting fired from a job. I don't know if you wanted to share any too.
Yeah. I think, like, in general, just anything that feels odd, I think always go with that gut feeling. Like, you know your people, you know your coworkers, you know your siblings best. And if you feel that there's some level of change, something that gives you a red flag, always trust that feeling and check in with them. It doesn't take it's not a big task to really just be there for a person and check in. And suicide is really complex. We like to use the analogy of Jenga. So kind of like there could be a lot of factors that come into play. There's not one real specific reason why it happens, but we're all human beings. We're all going through things. Life is difficult sometimes, and it's really difficult to go through things by yourself or to really separate yourself and go through it and feel that burden. Like sometimes it is good to vent and let other people know. And sometimes when life gets difficult, having that support system, whether it be with your family, whether it be with your chosen family or friends, it really helps relieve that. And I feel like we keep saying, like, we just have to have those conversations, trust those feelings, and like the specific examples that Brett provided, just trust it and go with it, but always with a genuine attitude, really caring for other people. And I feel like that it seems like simple, but it really just having that human-to-human interaction, what makes big changes. And imagine if we all do that for our communities, for our families. If every person takes the time to be there for one another, we can make that big change and reduce suicide rates to 0. So yeah.
In San Francisco, they one of the big things they talk about is putting a net on the Golden Gate Bridge, and we've talked about it before. I know I don't get a chance to go to the big council meetings, the Suicide Prevention Council meetings, sorry. But is there talk still? Or is there a net on the Coronado Bridge? Is there talk about it? Are we still talking about that?
Yes.
Does that help?
Yeah.
Okay,
Oh, yeah, yeah.
So what is that? Where is that in the suicide prevention world?
Yeah, for sure.
So is there kickback on that and stuff? What's that conversation about?
Yeah, so we have one of our subcommittees is our means reduction subcommittee. So it's focused on decreasing access to lethal means of suicide. And this is proven to be one of the most effective forms of suicide prevention. So as George mentioned, one of the common means is by jumping. And it's been a real movement here in San Diego to get a metal mesh net attached to the bridge as a deterrent, as kind of like a speed bump from keeping someone from taking their own life. And right now, it's actually in the stage where it needs to be funded. It's expensive. I think earlier this year, it was going through like an environmental draft period, like the proposal was. And I'm pretty sure it's moved through that stage, and now it's kind of up to like, how are we going to fund this? And just looking at how that could possibly work, whether it's going to come from the state or if it needs to get more creative. But yeah, there's actually Caltrans holds regular meetings about the Coronado Bridge. So our Vice President of Community Health and Engagement, Yanni Palomino, she attends those on our behalf and keeps us updated. And whenever there's actions that need to be taken, like public comment, a review or anything like that, we blast it out through our mailing lists, and we always bring it to our means reduction subcommittee.
And that's kind of where like gun prevention or things like that.
Yeah.
Fall into place,
Firearms, pills. Yep. Yeah, jumping.
Yeah.
Another big one in San Diego County is hanging, suffocation, asphyxiation. Those and firearms are really the top rates that we see. Yeah.
We talked earlier, I think before the table talk about like substance abuse and the correlation and some of the things we're seeing, trends with suicide and suicide prevention, is there anything that we could talk about as far as overdose or substance abuse? Is there anything there that we've learned from the report at all?
I think just with substance use, that's another warning sign for sure. That would be a kind of a indicator in your head that you should check in on that person. I think what we were talking about earlier is just with the rise of fentanyl deaths, it can sometimes be hard to know whether those were overdoses or whether they were suicides.
If anybody has a comment or would like to chime in on our conversation, please, we encourage you to comment. The microphones are on. Just grab them. Yeah.
Yeah.
Please.
Anyways, I wanted to add to some of the misconceptions, like especially in Indian country, we're taught and raised not to cry, not to talk about any of our issues at home, and that you're tough, and you don't say anything, you just write it through. We're taught that. And there's also it's everywhere we're supposed to live up to those things. And as far as substance abuse, I'm a substance use counselor. I know that a lot of people use for several different reasons. They start for several different reasons, but once you get going and get addicted, they're using probably for something that, some type of trauma, something like that. So actually, substance abuse use is actually a slow suicide because you're killing yourself. And then slowly your body deteriorates, your mind deteriorates, everything deteriorates, and you die, or you OD. So it's like I would say it's a
Self-harm?
It's a form of suicide. When people drink and drink and drink and drink, they finally die. Well, what are they drinking for? Because something happened to them, some type of trauma, some type of loss. And then again, in any country, you're not supposed to talk about it. You got to deal with how you're going to deal with it. So they deal with it that way. And so the more they use, it is a suicide because you're putting poison into your body. You're poisoning yourself.
Thank you for sharing.
Thank you, Paul. I have a similar comment and question. Just like Paul said, culturally and in familial norms, we're often taught, don't share your emotions, be strong. Eventually you'll get through it. That'll pass with time, and you'll come out stronger in the end. As a mother, I have a teenage son, so I was raised in that way to be strong. But I know that it's healthy for us to express emotion. So I'm trying to break that norm in my own family, but it's hard. I was raised to not show emotion, but I'm trying to raise this next generation to be comfortable with your emotion while not showing emotion myself, because it's still not comfortable for me. So what advice can you give to people in our positions where we were raised that way? We were raised to be strong, you'll get through it, don't share, but we want and recognize that that's not the healthiest way to do things. So what tips can you give to parents who are trying to make that change with their own children? How do we break out of that place of how we were raised to raise a healthier generation?
Yeah, I can take this one. I really appreciate your questions and openness. And I feel like those are issues that I go through too with my family. I feel like my parents, or my mom in particular, is very Catholic, very religious, but very old school, traditional in her way of thinking. And I always try to compare how my upbringing was and how I want to be with my kids. So I always try to you have to kind of force yourself out of those comfortable spaces. And it feels weird. Sometimes I question myself all the time, but I know that you need to push yourself out of those, to those uncomfortable spaces, but always remind yourself the purpose of why you're doing things. So I know that when I was growing up, I never talked to anybody. I never had a real deep conversations with my mom or my dad. It was very much like that. You control yourself, keep your composure, be good, and handle things on your own. But we can't, we need to push ourselves to be out of that, and also continue doing that and break those traditions that weren't the healthiest. And especially like with addictions, I feel within my family, there's a lot of addictions. And my father passed away due to an addiction. And I think that's not a conversation that's really discussed, but I do feel like it's a sense of like an act of suicide, because you kind of want to kill a trauma or something within yourself. Taking from a quote that I heard from one of our students in one of the event, like sometimes you just want to kill those feelings. It's really what you're trying to do, whether it be with alcohol, whether it be with smoking. And I always thought of that, like my father, he had a lot of traumas, and I always felt like he kind of gave up in life. And I feel like it is our responsibility to check in and also like even do the daily like self-care, like go to the doctor. Also in our culture, like with my mom, like my dad never went to the doctor because he was like trying to put this front of like, I'm the, breadwinner. I need to keep my composure. I'm a man. And he never went to the doctor. And if he would have gone to the doctor, his cancer wouldn't have evolved to the point that it did. And that's always something that hurts me and makes me feel like, even if I feel something, I'm like, I need to go to the doctor, because it's always better to being safe than sorry. And sometimes when we push those things and we don't listen to it and we want to minimize it, like it can build up to something even bigger. And it's also like that with your mental health. If you isolate yourself, you don't tell anybody, like these things that are happening in your life can build up to being something even too overwhelming that you won't be able to handle at one point. And when you talk about it and you express, it's like that feeling of like, God, like I have that with my friends sometimes. Sometimes it's overwhelming and I feel like so much emotion. I just give myself that moment. I talk with whoever at the moment, my friend or my sister, and I always have that feeling of like, wow, I'm so glad I did this. It definitely gives you that. So always having that open communication, finding that support system, but also forcing yourself out of those spaces, making you, even if you feel uncomfortable, and reminding yourself why you're doing things. I think it's very powerful.
Thank you for sharing.
Yeah, thanks, Susanna.
Hi, can I add something? It's not only in this culture, it's not only the negative, like or like what we call the bad emotions, right? It's not only just saying when you're sad or when you're mad or when you're angry or hurt. It's also saying I love you, and saying I'm here and being that vulnerable. Like in our community, a lot of times it's, you just know that, right? You're my cousin, you're my mom. You should just know that I love you, and maybe I don't say those words. And so it goes both ways. It's all emotions. It's not just the, I'm sad, I'm mad, I'm hurt, I'm lonely, but it's also the need of feeling wanted and in the community, and hearing that verbal I love you, and being a clinician in this community and working with a lot of people. I have kind of just answered some of that question, Angelina. In my own family, as a kid, as a teenager, I never heard it, but I'm older than my siblings. So a lot of the times I wanted them to know that I loved them. So I started with a game. So just something I did in my family is, we started with the game of saying 1, 2, 3, I love you. And if you could say 1, 2, 3, I love you before the next one, then you win, right? Because it wasn't safe to say I love you. It wasn't, because what if I don't hear it back? What if they don't say it back? What if they don't mean it? What if I say it and they look at me like, oh, why are you saying that? So even to this day with my adult siblings, before we leave, we can say I love you, and I do with my own children. However, with my siblings, we still say 1, 2, 3, I love you to the stars. So that's like the end of it, like when we leave, because it wasn't safe for me as a 16-year-old to say I love you, because I never had heard it. I never had heard I'm proud of you, right? So like it's all that, right? It's all those emotions. It's like, oh, you should know I'm proud. I'm at your event, or I'm at your soccer game, or I'm at your basketball game.
Power's on. No, sorry.
Oh.
Like the power's on. There's food on the table.
Yeah.
Yeah. Sorry.
That's how I was like, sorry, I thought it was my microphone. So being
Give you
able
a ride to school or something.
Yeah, that's how I love you, right? And if we know, oh, I didn't know we don't, sometimes our love languages are different, right? So you providing and giving me those gifts, I didn't know that was, I love you. I thought I needed to hear it because that's society. Like, that's when I go to school, I hear other kids say, oh, I love you. Bye. Have a good day. And I never heard that. It was like, all right, see you when you get home. But that was like the two difference, right? Like, why do I get see you when you get home? And my best friend gets, bye, I love you. Have a good day. Go conquer the world. And I'm like, well, I probably wasn't even getting dropped off at the time. I was on the bus, but I was able to rationalize that.
Yeah, I resonate with that so much because I feel like growing up, it was expressed to me, love was expressed in acts of service a lot. But for me, I received love through words of affirmation. So there was just this mismatch of like, yeah, like feeling like unloved. And I feel like I wasn't finally able to put that all together until I became an adult. But it's hard, and it could be so confusing for our youth, for sure.
And I know you guys, I know we got you guys till 1 and we're rounding through, but that was such a good conversation, good question. And I think what you were sharing is important on the groups that we're having now, the Mending Broken Hearts and the Celebrating Families and these groups that we're putting together, because I think that's really important. We don't know if we're going to get it back, and I'm noticing now, like, being a man, a father, and being vulnerable, and I have to, show myself first, to expose for people to trust me. But in group work, I think we can learn from each other that it's okay to not be okay. It's okay to love and to be loved. And that's what one of the things I think we get a lot from those groups that you're teaching, that you shared. And so I encourage people to take them, and I think that's why they're effective, just like coming into the doors, coming into the therapy room. But those groups are powerful. And a lot of medicine is shared in there. A lot of tears fall. A lot of love. A lot of the "I love you" words are shared. A lot of pain. A lot of healing. So yeah. Good.
And I
good
just
talk.
wanted to add, like, hearing "I love you" and taking it in and being able to accept it, right? Being able to accept it. And I think at the end of the day, we do show our love in many, many different ways. And if it, we are here and being able to enjoy those journeys. And something that I have seen of not saying "I love you" is like when you kind of hit George right now, like having that guilt, right? That I never told them. Did they ever know? Right? Like, and sometimes that burden of guilt and shame is what our people are carrying, because they didn't have that opportunity to say it because they didn't know how to say it, right? Or they didn't know how to take it in.
And they literally didn't know how. And, so how about you close this? I know you guys are going to get going. So let's bring this back. Really good conversation. Almost, we did our own little group there. We had our director of behavioral health
Really
take over. So that was a session. That helps. I'm getting help here, just for the record. Everybody knows. But yeah, we're out here. We're out here doing this. Chip, we're out here.
Oh, yeah.
So we take a lot of pride in our work. We got our people out here that are taking care of our people, that love our people. Really put a lot of pride and heart. Whoa. What the heck happened?
Let it come.
What the heck was that? Paul, grab the mic. What the heck? What the heck was that? Jeez. We absolutely care about what we do. We absolutely care about what we do. And it's real stuff. This is real stuff in the house, in our home, and in our community, and in our work. So I'm really, really happy you guys made it. I really, really appreciate you guys. These are my friends. These are my buddies. These are my confidants. This is who I turn to for all my stuff, all my suicide stuff. These are my number one resource. So I know you guys are gonna get going. Do you want to close us out with something?
Yeah.
Please.
Just thank you all so much, just for welcoming us into your space and for sharing this afternoon with us. Thank you, George, for being such a good partner. I think I just should share the San Diego Access and Crisis Line, just for anybody who's tuning in. It's a really special resource that we have here in San Diego County. The number is 1-888-724-7240. And it's staffed by mental health clinicians that are always willing to talk and help out and provide support in a crisis. And it's the number one referral that we make. It's always the best place to call if you need help, if someone you know needs help. So yeah, just wanted to share that. Susanna, I don't know if you have anything else to...
Yeah, I just wanted to say thank you, everyone, for being so open and vulnerable and sharing so much. I feel like it was such a communal discussion. Loved it. And I just wanted to say I really love what Paul said, like suicide prevention should be every day.
Yep.
So I'm going to honor that. And yeah, it should be every day. Let's talk about this and really take it to heart and do these changes or work on this like on a daily basis, starting with ourselves, like self-caring for ourselves and also manifesting that or, helping everybody and checking in with everybody in your circles and around you and in our community. So thank you so much.
Yeah, thank you guys for coming out.
Thanks, George.
Thank you. So I think we're going to share some of our events coming up, what you guys are going to head on out. All right? Safe travels.
Yeah. And visit our website. Get connected. We're always there. All information is on the website, like Brett mentioned. And yeah, just know that you're not alone and we're all here together.
Yep. Good to see you guys. Take it easy. Tell Yini I read the report. Yep. Dave designed the hat. Yeah, and 988. Also, 988. You could plug in 988. That fly was getting us all day, right? 988 is a new mental health crisis line number. Is that right?
Okay. So 988 is like the new nationwide number that's taking over for the National Suicide Prevention Crisis Line. We're still really promoting the Access and Crisis Line just because in San Diego County we have such a melting pot of people from all over. And if you call 988 and you don't have a San Diego area code, it's going to direct you to resources wherever your area code is. But if you do have a San Diego area code and you call 988, it sends you straight to the Access and Crisis Line. But we're really stoked to have 988. It's just an easier way to get help fast, and it's an easy way to spread the word. So, yeah, thanks for bringing that up.
Thanks for that. That was a good question. You got me, though. Hey, I caught me slipping. Hey.
Made him work today.
So we got some events coming up. We have our suicide prevention walk that is coming up Monday. If you've registered, thank you. We'll see you on Monday. If you haven't registered yet, we have the flyer posted up there now. You'll see it on our social media. Go ahead and click the QR code, or there's a hyperlink on the flyer, or there's a link on the flyer too. You could go on there, register. There's a walk. Wear yellow, and you could help. Yellow is the suicide prevention color. Got to get that right. I've been tongue-tied with that all day. How's that?
The theme color.
Yes, the theme color. So that's on Monday at noon. We're going to start walking around noon. We're going to have our welcome and blessing by Mr. Drum Arviso, who's been here from day one doing our blessings and our welcoming. Mr. Arviso is always been supportive of our programs. He's a huge advocate of our movement. He is always helpful, and we just talked to him, and he said he's looking forward to it. He's got some strong words, so we look forward to seeing him out there on Monday. Followed by the walk, we're going to have a QPR presentation, as our friends were talking about today from Chip. We're going to have QPR, a question, persuade, and refer presentation. Those that sign up are believers on the same link. Is it the same link? Yeah, the same link. So if you sign up, join us, slide over after the walk. You could slide in. I think we're doing that in the multipurpose room. Yeah, and that's a 3-step tool to help people. If you're looking to get more information on suicide and suicide prevention, that's a tool you'd want to do. You know, we also have a mental health first aid training. We actually have that going on as we speak. That's why Art and Marissa aren't here. You know they would be here, but they're actually handling the our mental health first aid training. That's a great program that's going on now. That we had those going on throughout the month, but we're going to close out the month on Monday with our suicide prevention walk. Is there any other activities that we got coming up? Let's see. We got our vaccine clinic. We have our podcasts. Check out our podcasts. How about the outdoor setting from David Dawson? This is our audio video social media extraordinaire. I never get his title right. Help me with the title. Multimedia master, multimedia specialist, multimedia coordinator, multimedia coordinator. Good job, Dave. Thank you for setting this up. Our friends asked, and he delivered. So thank you for doing that. Dave put this thing together solo. So and I think it came out all right. How did it sound? Sound okay out there? Cool. And if you guys got any questions, we're going to stick on here for a while longer. If you got anything to add, there's another program we have, Living Well with Diabetes. This is going to be next Wednesday in the multipurpose room. This is this is a program from the diabetes team, and this is going to be from 10 to 11 in the multipurpose room. Are they doing food with this too? I wonder if they're going to do food. Lorelei and the diabetes team will be there. You guys know Lorelei. Have you guys seen Lorelei's cooking channel yet on our YouTube? They share it on Facebook.
Yeah, if you haven't checked it out, make sure you're going to our YouTube channel. It's youtube.com/Indian Health Council. And join us for Lorelei's IHC In The Kitchen cooking show once a month, typically the third Wednesday of every month.
IHC In The Kitchen.
Yep.
Yeah, Lorelei, if you guys know Lorelei, you guys know how she gets down in the kitchen and she makes it happen. And it's a healthy meal, right?
We could play one of those to finish out today's episode if you'd like.
Yeah.
Yeah. So let's get through the email and I'll pull one up.
Yeah, I think that's cool. Yeah. So let's see. What else we got? You got anything else coming up? Let's see.
Spiritual Unity Movement.
The Spiritual Unity Movement Men's Support Group. Oh, I saw this one. Tuesdays, 5 to 6:30. See, this is another group that we're talking about. Some of those support groups, you know, not everybody wants to come in and do the counseling. Not everybody wants to come in and do the therapy. That might not be where they're at, and that's okay. You know, groups have a huge impact. You know, even if you want to come in with somebody. But this is another one. This is from Paul Gonzalez. You heard Paul. Paul was at our table talk earlier with some feedback, and actually, this is Paul's group that we're sharing here. The Mending Broken Hearts program that goes on every Wednesday. 3-day intensive workshop, Wednesday, Thursday, Friday, and then 3 follow-up circles. That's probably one of the most powerful groups that we have.
I think Paul had told me yesterday that they were down to 1 seat available. So if you want to get in on this, follow up.
A lot of medicine there, a lot of healing. This is where a lot of this stuff that we talked about happens. But you know, you got to be ready for a lot of emotions and talking. So it's a really, really, really good group. We're fortunate to have that here. So I really want to encourage people that need some healing, that need to address grief, loss, things like that. If grief and loss, can you go back down to that one, to that last one, that Many Broken Hearts? Really quick? Oh, I can't. Yeah, there you go. If you're dealing with grief, loss, and if it's just something that you or a family member, is just struggling with, and it's been going on for some time, years, and you don't know how to help this person, this is something that could help. This program, this class, this program, this workshop, this training, this group, this is powerful stuff. It's 3 days.
8 hours.
Yeah. Yep. It's 8 hour days with 3 follow-up. Thank you. It's intense. It's a lot, and they go through the steps and you name it. And there's a lot of stuff comes up and healing. They go back to the circle. There's some prayers and some medicine, you name it. So again, if the grief is something that you're dealing with, or your family, this is something that I encourage you guys to take part in. So, thanks. Next one. I think the next one was the California Indian Day.
Yeah, there's like a 30-second delay
sorry.
before you see
Thanks.
it.
So that's Pachanga tomorrow. What's going on down there? California Indian Day gathering at the Cove. Oh, Pachanga gets down. That's going to be a good one. Let's see. We got a peon tournament, shinny tournament, celebrating. There's going to be some dancing, some singing, some tradition celebrating California indigenous culture, heritage, family, and traditions. So if you guys know how Pachanga gets down, that's going to be a nice, fun, beautiful day out there. They always host amazingly, super gracious when they open it up. That's going to be a nice one. San Pasqual Native Women's Resource Center, San Pasqual Fire Department, they got the banners going up on the street. This was going to be a big one. This is Saturday, October 1st. This is going to be at the San Pasqual Ball Fields. This is going to be a domestic violence and awareness walk and resource fair. They're going to have the fire department down there. They're bringing the helicopter and it all promoting this thing. This will be really, really big. This is going to be down there in SP, down at the park. You guys been down to the park where we had our opioid walk? That was a good one too. The opioid walk. That was a really powerful event. That's going to be down there. There's a QR code, and if you have questions, give them a call. Evelina Chavez and Cheyenne Boston, how you guys doing out there? Give them a call. I'm sure they can get you guys hooked up. I'm sure they're doing some booths and get you guys registered. So check that one out. And then, is that it? We got more stuff?
As the Indigenous Ancestral Healing Collective announces their launch of their Indigenous Anthology, A Healing Journey booklet. If you scan that, that's the Indigenous Ancestral Healing Collective.
Say no more. Jermaine? Is it Jermaine's thing? Nice. Shout out to Jermaine. I saw her at the fiesta. Jermaine used to work out here. She is awesome. And so I can't really read the font on here. The Indigenous Ancestral Healing Collective.
Well, I think it's probably better rather than you reading it. At the bottom of the screen on the live stream right now is a link to our link tree.
Oh, there it is.
If anybody follows that link, they can access all of our social media accounts from there, as well as sign up for this email newsletter, which comes out weekly. Perfect. So if you go there, you can sign up for this newsletter and get this in your email inbox at the beginning of every week. So we want to make sure that everybody's aware of that resource and that availability is there for the whole community at large.
Perfect. And hello, Jermaine, if you're watching. Good to see you. Good to hear.
And that is it for
That wrap
the.
them up?
Yeah.
All right. That was a long afternoon. That was I'm glad our friends made it out. Dave,
Yeah.
thanks for putting the set together.
You're welcome, sir.
I was quite a task. Thanks to our guest that joined us. And thank you for being patient. And I think we're going to close it out with a video.
Yeah, let me pull that up, and then we'll get that started here, and we will go from there. Let me see here.
And thank everybody that shared with us, and thank for the messages. And again, join us on Monday, and everybody could help. Everybody has a part in this. So thanks for hearing me out for the many viewers in attendance. But good to hear from everybody. Dave's going to close us out with a video here in a minute. Dave, let me know when we're ready.
I'm ready, so I'm going to take you off the screen. I'm going to put Lorelei up. Till next time. See you later.
Welcome, everybody. Today is another Indian Health Council in the kitchen. My name is Lorelei Legaspi, Public Health Representative, Certified Nurse Assistant, and I will show you another quick recipe for our episode today. I am going to show you a shrimp lettuce wrap. It's summertime and it's warm outside. We don't want to be cooking in the kitchen. We just need to be, something quick and easy and very satisfying and nutritious, okay? Let me go through the ingredients. My ingredient, I got a 2-pound large shrimp, and it's peeled and deveined, and I got some taco seasoning, just the plain one. I got plain Greek yogurt, very simple salsa, just tomatoes, onions, cilantro, and I squeezed some lime. I put a little bit of garlic powder and some cayenne pepper for a little spice, for this salsa. All right, but we will put this on the side later on. All right, you can use this taco seasoning, and if you are making or using only a pound of shrimp, you can use half of this seasoning, and half will be from the dressing, the yogurt dressing. Okay, the shrimp, I put only half, this is 2 pounds, so I put the whole packet of taco seasoning, and it's peeled and deveined, and now I will put it in a little skillet with a little bit of olive oil to cook the shrimp. So I will make only a very small batch for you to, for demonstration, but do not pack our saute pan because it will steam up and a lot of the juice from the shrimp will come out, and you don't want that. We just want it, it's cooked, but all the juice and the goodness from the shrimp is still intact, okay? So I will make some of the shrimps. I will set aside the shrimp here, and this is, make sure you have enough time to kind of marinate the shrimp. You want the flavor to kind of really absorb the shrimp. So it takes only a few minutes, less than 2 to 3 minutes. And we will, while this is cooking, I will show you how to make the Greek yogurt sauce. Okay, so this is the sauce, and you can put about, it depending on how much shrimp you have. This is your Greek yogurt. I will put a little bit of the taco seasoning. You can taste it first before you add some more if you want. And I will put a little bit of lime juice here. Okay. There you go. It's as simple as this one. You can make it a little bit spicy if you want. You can put cayenne pepper or chili pepper flakes if you want. But I want a little bit more color. I will put more taco seasoning here. All right. So this is good. We will set this aside, and we'll go back to the shrimp and kind of turn it over. Oops. Okay, oops, a little bit charred there. All right, so this is our shrimp, and it's very quick to cook. Look at that, it's a little kind of overcooked, but it's okay. That's all right. But let me show you how to plate this one. See, it's very easy. And again, I have some lettuce here. And you can make little ones or big ones. The lettuce, I have some nice ones here. And I can put the shrimp here. Oops. Be very generous with the shrimp, okay? I'm sure your family would love this one. Shrimp. Okay. And we can put this sauce on the side. They can dip this one. And we can put a little bit of cilantro on top. And a little bit of this salsa. All right? Okay. It's beautiful. Look at that one. It's very simple, and try it at home. All right? Thank you very much, and I will see you next time.